Hello, I'm Shane Castus, is the Superintendent of Asheville City Schools, and today we're going to be exploring some of the questions and items that we've heard associated with COVID-19, and as our community works together to prevent the community spread, and then also to learn about how to keep healthier learning environments as we go into this in the future. And then also at the very end, we'll have a discussion about the possibility of the vaccines that we're very excited about. So to help us today go through that conversation is someone that we work with very closely and someone we've come to appreciate so much here in Asheville City Schools. April Baur is the School Health Program Manager at the Mountain Area Health Education Center, or MAHEC as we know that better. She is joining us today after 14 years of nursing experience, and she has served the students and the staff of both Buncombe County and Asheville City Schools as part of our health program since 2015, and she's the parent of an Asheville City School student. So April, we're very happy to have you here today.
Thank you. Glad to be here.
If you could, let's just jump right in. So since March of 2020, there's been a lot of talk about positive cases, positive COVID-19 cases. And as someone who works with schools and school nurses, can you describe the protocol and the process of what happens when a case of COVID-19 is reported to you?
Yeah, so essentially, as soon as the case is reported, the school nurse is notified. And in Buncombe County, all of our school nurses that work in our Buncombe County and Asheville City schools have been trained in COVID-19 case investigation. So that means that all of the school nurses serve as case investigators for all of our Asheville City school related cases. And the process of case investigation includes contacting the person with COVID-19, and we call that person the positive case, and getting a little bit more information about their illness, including their symptoms, their travel history. And then the nurse also works with that positive case to identify all of their close contacts, and the nurse notifies those school-related contacts directly. So because our school nurses serve in that role as case investigators, that really allows us to quickly identify the school-related positive cases and close contacts, so we can get those notifications out quickly and also maintain everybody's right to privacy.
And I just want to say what a fabulous job you guys have done. And, you know, it's not that you would think as this has gone on, this would be getting easier. If anything, it's harder now than it's ever been, and the limit and the stretch that you guys have been placed under has been just enormous, and you guys have performed so well, so thank you. Can you tell us a little bit about the county's dashboard? There's a COVID-19 dashboard that measures items in schools related to COVID-19. Can you tell us about that?
Yes. The dashboard was created after, we heard clearly from our community that people wanted information about those individual cases. So on the COVID-19 dashboard for the schools, that's where we report all of the cases each week for students and staff who have been on campus at our schools. And I think that the dashboard, is a really great way for us to share that information with our community, provide that transparency and information. And then again, as I mentioned earlier, still protecting confidentiality.
Now, another term that we hear on that dashboard is a cluster. So can you talk to us, what's the difference between an individual case versus a cluster?
So the cluster, probably a lot of people at this point are familiar with that term and have heard it, but a cluster is a minimum of 5 cases in a school that are epidemiologically linked or connected, and the clusters are actually reported through the state, through the North Carolina Department of Health and Human Services dashboard.
So when someone tests positive, we talk to them about isolation, and then there are people in their home that have to quarantine. So there's a difference between those terms, aren't there?
Yes, there is, and people do often use them interchangeably, but it is isolation for people with COVID-19, those positive cases, and they have to isolate until they have met all of the following 3 criteria. 1, it's been at least 10 days since their symptoms started or since their test if they don't have symptoms. 2, any symptoms they do have improved. and 3, they've been fever-free for at least 24 hours without using medication to reduce a fever. So that's isolation. And then, as you mentioned, the close contacts are required to quarantine, and that's for up to 14 days from their last contact with the positive case. So in the case of a household member with ongoing contact, sometimes that quarantine period is a little bit longer because it doesn't actually start until the person with COVID-19 has been released from their isolation. And to explain a little bit about close contacts, most people are probably aware by now, but close contacts are those individuals who are considered to have been exposed to COVID-19. So we define that as anyone who's been less than 6 feet away from the person with COVID-19 for a cumulative 15 minutes or more over 24 hours, or they've had direct physical contact with the person. And the time frame that we look at for that is starting 48 hours before their symptoms started or before their test date, up until they were able to begin isolation.
So a common question I know that we have here, I have been in contact with somebody who's a close contact. They told me they had been exposed, and then I've been close to them. Should I be considered then for isolation or quarantining or testing or anything?
Yeah, that is a very common question. And the answer is no. For someone to be considered exposed, they do have to have that direct contact with the positive case. And a way that we say that a lot is a contact of a contact is not a contact.
What if a close contact, April, tests negative? Do they still need to finish a quarantine or have to quarantine?
Yes, they do, but the length of quarantine will depend on different factors, including test results and symptoms. So I'm sure that lots of people have kept up with the CDC recommendations, and the guidance did change and now allows for a close contact to end quarantine earlier than 14 days. So that can be after day 7 if they have a negative test. And they don't have any symptoms, and then it could be after day 10 if they don't take a test and don't have any symptoms. But with that, I think it is important to remember that a close contact can still develop COVID-19 up to 14 days after exposure. So if someone does end quarantine earlier than 14 days, they do need to continue monitoring for symptoms and, of course, following all the safety precautions.
So can someone in a quarantine go and run basic errands? Can they go out and drop off kids at school? Any other activities? Or does the quarantine mean no, you really need to stay home?
Yeah, the quarantine does mean you really need to stay home and avoid contact with other people. Definitely it presents challenges, especially in households where multiple people, are impacted. And we understand that there are situations where somebody may have to go out, like to a doctor's appointment. But as much as possible, it really is important to stick to quarantine because, like I mentioned, it can take up to 14 days for a close contact to get sick with COVID-19. And we really want to try to minimize that potential transmission. And we know that people can be contagious before symptoms develop.
Our student services department has been so wonderful, and if a family was in a situation where they needed things, we've been able to bring those items to families, and it's really been nice in the community to see people really reaching out. So please know there are resources to call on rather than trying to go out and do something yourself.
Yeah, thank you. That's great. I will say that has definitely been my experience in this position. Just seeing the help that is available to folks has been really great. So yes, reach out.
Talk to us a little bit, April, about the COVID-19 screening process at school. What is that like? Parents are curious, like when students come, what will that look like?
Yeah, everybody entering a North Carolina public school for any reason is required to be screened, and that's according to NCDHHS guidelines. So that process is pretty robust. It includes screening questions and a temperature check. And following the screening, students or staff would be excluded for any of the following reasons, and that would be if they have had a positive COVID-19 test, if they've been identified as a close contact of a positive case, or if they have one of the following symptoms, which include fever, chills, shortness of breath or difficulty breathing, new cough, or new loss of taste or smell. And household members of anyone who screens positive would also be excluded. So if a staff member or student does meet any of these criteria, it's really best to stay home. For students, we would say, keep them home and contact your child's school. Our school nurses do follow up with everyone who's been excluded from school, and they work with the families to offer that guidance and support, and they'll determine when someone who's been excluded can return.
At this time, we are past the holidays and we expected to see sort of a surge. That surge has certainly proven to be sadly true. So right now in Buncombe County, where does that spread seem to be occurring, and do you see a trend at this moment?
I would say we definitely are seeing high rates of community spread. You're right, we have definitely seen a surge, as has been the case after every holiday. And so we're hoping to start to see that kind of level off. I will say that we do know small gatherings can be a significant factor in COVID-19 transmission. So it's just really important for everybody to follow those public health guidelines, avoid gathering with people outside of your household, and of course, always practicing the 3 W's, which is wear a mask, wait 6 feet or more apart. And if you can't measure in your head how far 6 feet is, it's about the length of a twin bed. And then of course the 3rd W, which is to wash your hands. And we all know the 3 W's work well individually, but they're also additive. So that means they work even better when they're all used together. So wear, wait, and wash.
And even more so when all of us do all 3 W's, that multiplicative effect is definitely obviously evident. So as we sort of switch gears here for the last part of this conversation, I want to talk a little bit about the vaccination and the COVID-19 vaccine. That's obviously where your efforts as the medical profession have spent a lot of time to get us to this point.
Talk to us about the vaccine, the 2 types that are currently available, and what that rollout is going to look like.
Yeah, thank you. The vaccines are really exciting. I think they're definitely going to be a key part of, our community and our country returning to normal. As you mentioned, we do have 2 vaccines currently approved in the United States for use, and both of those do use mRNA technology. And I think for a lot of people that sounds new, but it's actually been studied for many years. So we know that it's safe, and we know that these vaccines in particular are both safe and effective. Both of the vaccines that we have now do require 2 doses. And I think that sometimes people have questions about, whether the vaccines can make you sick, what's in the vaccines. And so I think it's important for people to be able to get good, solid information. I will say the vaccines do not contain any part of the COVID virus, so they aren't going to make you sick with COVID. Most people do have an immune response to vaccines, and so that can be things like, fever, chills. Certainly, at the injection site, people could see some redness or soreness. But for information about the vaccine, I would say a really good place to go is the North Carolina Department of Health and Human Services website at covid19.ncdhhs.gov/vaccines. And that's also where people can find out about the North Carolina plan for distribution of vaccines. Right now, there are 5 groups that we're looking at for that vaccine distribution. And currently, as of right now, North Carolina is vaccinating people in groups 1 and 2, which includes people over the age of 65 and healthcare workers.
School employees, those will be in group 3, correct?
Yes, school staff are considered frontline essential workers, and they are in group 3, which is the next one up. And it'll just be a matter of, how long it takes to get through groups 1 and 2 to get into group 3. But I'm hopeful that it will be fairly soon. We definitely want our school staff to be able to get that vaccine.
We still are offering tests, obviously, and there are different kinds of tests. So can you tell us about the test and a recommended test for someone to take if they are worried about COVID symptoms?
Yeah, so yes, there are different tests. I think most people are probably familiar with the PCR test, and that's a nasal swab that usually takes a few days to get results. That's really considered the gold standard and the most accurate test we have. However, we are seeing a lot of rapid antigen tests used as well. And those also involve a nasal swab, but you get results back in about 15 minutes. And with the rapid antigen test, if it's positive, then that's kind of the final result. But if it's negative, often they will follow up with a PCR test to confirm that. Anybody with symptoms of COVID-19, anyone who's been exposed to someone with COVID-19 should definitely get tested. If you've been exposed and you have symptoms, then you can get tested right away. But if you don't have any symptoms, then you should wait to get tested until it's been at least 5 days after that exposure. And, the contact tracers will typically work with people to provide that guidance. As part of a pilot through the state, we're going to be able to offer that rapid testing in schools to people who meet the criteria. So that would be anybody who develops those symptoms of COVID-19. So we're excited about that, and we'll share more information about that soon. And then beyond that, for testing, anyone in Buncombe County can go to buncombeready.org or call the BC Ready line at 828-419-0095 to get an appointment. And MAHEC also offers COVID-19 testing, and the number there is 828-771-5411 to get scheduled.
April, thank you so much for all you're doing and for the information and the time today.